So patient-reported outcomes, I have to say that they have been introduced quite late in comparison to other outcomes that we have always been looking when talking about prospective clinical trials or a treatment outside prospective clinical trials that are basically efficacy and side effects. But of course they are really very important. In fact, the patient is the one receiving the treatment, so the patient has to verbalize how he or she is feeling with the treatment that is being administered, and maybe the treatment might be very effective, but if the way that the patient is feeling with this treatment or the impact that the treatment has on patients' daily life is really so bad, maybe this treatment is not so good. So patient-reported outcomes have been introduced, I would say, in all prospective clinical trials nowadays. They have a special importance, I would say, in the elderly population of patients, because even if they are fit, just because of the age, sometimes when they start receiving treatment, they are not so fit. And of course, they help physicians and clinicians outside prospective clinical trials to make some decisions if you have two different types of treatments that give you kind of similar efficacy. Of course, the treatment which is better tolerated by the patient and that the patient has the feeling that their daily life is not so impacted, probably this is the one that is going to be chosen by the physician.